Describe this pain to me if you can, because I know it's extremely painful. Who is at risk for this? Does it come and go, or is it just permanent?
Right. So lower back pain with or without leg pain or sciatica is extremely common. Most Americans will experience this. Unfortunately, when you start having a back problem, then you are more likely to have it experience again. And now we're sort of learning about it. If we're not able to manage it early on, then sometimes these exacerbations become more often and can become more frequent. So we really have to get after the problem in the beginning. It has a multimodal kind of distribution, meaning you can have it at different times in your life. So earlier in life or your midlife, it's usually a disc herniation that's causing this compression or from sports or trauma. Later in life, it's usually from arthritis. The arthritis is an overgrowth of bone that starts to narrow those nerve holes. So when you narrow the nerve holes, now you have a smaller area that the nerve can traverse, and different positions or poor positioning or some of those occupational hazards that we discussed earlier can pinch that nerve and cause radiation of pain.
Is there something that can aggravate it more where they can then say, oh, great advice there, not to do?
So right, so the number one thing I always tell patients not to do when they're having acute pain or even when they're getting better is that we know that forward flexion or bending at the spine can cause increased interdiscal pressure, and that can push the disc fragment back if we're talking about disc herniation. So if you're sitting, bending at the spine with poor posture and lifting something, that's probably the worst. Standing, bending at the spine and lifting something, that's also extremely bad, and I would really recommend people don't do that. You can bend at the hip, it's called hip hinging, and really strengthening the core and pelvic girdle, which is the key to different exercises and depending on what you're trying to do.
Because if you do that, then what? You're just exacerbating the situation and possibly...
You're gonna hurt yourself. You may increase the hurt, but you're probably not going to increase your harm. You're not going to damage what's already done, but you may increase the pain and increase the inflammation, which is what we're trying to target and remove.